Thank you for coming today. Merci d'être venu aujourd'hui. I am Corporal Julie Kurshane. Je suis la Corporale Julie Kurshane. The Honorable Heather Stefanson, Premier of the Province of Manitoba, is here to speak to you about this tragedy. L'Honorable Heather Stefanson, Première ministre de la Province du Manitoba, est ici pour vous parler de cette tragédie. The RCMP is prepared to speak to what investigational progress was made over the weekend. La GRC est prête à parler de la procédure d'enquête menée au cours du fin de semaine. Lanette Siragusa, the CEO of Shared Health Manitoba, is also here to provide an update. Lanette Siragusa, directrice générale de Shared Health Manitoba, est également présente pour faire une mise à jour. I would like to invite the Honorable Heather Stefanson, Premier of Manitoba, to the podium. Je voudrais inviter l'Honorable Heather Stefanson, Première ministre du Manitoba, à prendre la parole.
Thank you, Corporal Kurshane, and good afternoon, everyone. Thank you for being here today for this important update. I know that the last few days have been extremely challenging for people right across our province, in particular those in the Dauphin area, but it really has affected all Manitobans. Last week we experienced a devastating tragedy that we have seldom seen before. My heart is broken for the families and loved ones affected by this tragic event. It's tough to even begin to imagine what those families are going through right now, and especially during this very difficult time. And I'm sending, on behalf of all Manitobans, our deepest condolences to those who have lost loved ones, and our prayers are there for those who are continuing to fight for their lives in hospital. I know how hard it must be as we all await more information. Please know that our first responders, the RCMP, and health officials are working around the clock to ensure that we get as much information out to you as possible in a timely way. Everyone involved is working diligently and showing their true Manitoba spirit to support one another during this difficult time. To the first responders, to the dedicated healthcare staff, the RCMP, to STARS, thank you from the bottom of our hearts for the incredible work that you have done during this very difficult time. Manitoba is a province where everyone knows everyone. These are our friends, these are our neighbours, these are our loved ones, these are members of our community. This tragedy is felt not just by Dauphin, but by people right across our province. We're a small prairie province with a mighty heart. And I'm proud of all the incredible individuals who are helping where they can. Just this past Saturday, I was out in Carberry at the Carberry Cypress Langford Fire Hall barbecue. And it was absolutely heartwarming to see the wonderful people band together for those in that community. They came from communities right across our province, from fire halls in different areas and different communities. There were reeves and mayors that came from different communities and citizens right across our province. And I think it shows, it's indicative of who we are as Manitobans. When times get tough, we band together and we help and we support one another. I've spoken to the Mayor of Dauphin and the Reeve of the RM of Dauphin and many local fire chiefs and officials in the healthcare system and the RCMP, and I can tell you they have been doing incredible work, and I just want to take this opportunity on behalf of all Manitobans to thank them for the incredible work that they have done in a short period of time. I have instructed Manitoba Health to immediately make resources available for family members affected to be reimbursed for any travel, hotel, or food costs needed. So if any of you have to travel for your family situation, our message to you is that we are here to help you during this difficult time. If you're someone affected and needs assistance, please call 204-786-8000. Additionally, personal contact information has been given to representatives in the local community around Dauphin. So Mayor Boziak, Reeve Ernie Sursky, as well as Brad Mikuleski, our MLA for the Dauphin area, have access and know how to reach out to areas of need. I have also given the Mayor and Reeve my personal cell if there's anything that I can do to help move things along as well. We are all in this together, and we will be there to help those in need in the communities. I also want to thank all of the other premiers across the country who have reached out, and to the Prime Minister, as well as other citizens across the country who have reached out to offer their condolences. I want to thank them on behalf of all Manitobans as well. Right now, our province is grieving, and we thank everyone for standing with us during this very difficult time. Today and every day, we are Dauphin strong, and we will continue to band together as a community to ensure that we have and support all those that are in need. Thank you. Before I pass this back to the RCMP, I would like to ask for a moment of silence in remembrance of those who have lost their lives in this tragic accident. Thank you.
Thank you, ma'am. Merci. I would like to invite Superintendent Rob Lasson, Officer in Charge of Major Crime Services, to the podium. Je voudrais inviter le surintendant Rob Lasson, responsable des services de lutte contre les crimes majeurs, à prendre la parole.
Thank you, everybody, for coming today. Thank you, Premier Stefanson, for joining us here today. That's very important. As everyone knows, it has been a difficult few days for everybody in this province. Nobody more so than for the families who were directly affected by the deaths of their loved ones. Being informed on Friday that their loved one is now believed to be among the deceased is very difficult. I can assure you that our investigators worked tirelessly throughout the weekend, continuing to look for the answers as to what occurred on the highway on June 15th, where 15 of our friends and family were deceased. We were able to interview some of the injured who were able to speak with us over the weekend. This is a very important part of the investigation, hearing from the people that were actually there. These were tough interviews to conduct. These details, however, can't be divulged at this time, as there is some important details to the investigation, and those answers will come at the right time. A few more investigational updates. The mechanical analysis of both vehicles is ongoing, and I need you to understand that this takes time, and we don't anticipate having these accurate answers for a number of weeks or months. The RCMP Traffic Services Unit has been working closely with Major Crime Services investigators right from the outset of the investigation. These are specialized investigators. These are experts in providing the evidence we need to further this investigation. 4 forensic collision reconstructionists and 2 criminal collision investigative team members are working tightly with our investigative team amongst Major Crime Services. Importantly, and to note, we continue to work and maintain a close relationship with many of our partners across the province. The Office of the Chief Medical Examiner's Office, Manitoba Highways and Transportation, Manitoba Motor Carrier, Manitoba Health, and Workplace Health and Safety. The autopsies of the deceased have started. This will begin the process of identifying the victims and will provide more information that will greatly assist our investigation and bring more closure to the family. Importantly, all steps are being taken to get the answers as efficiently as possible, keeping in mind, like I said in previous media releases, that accuracy is paramount, something that will not be sacrificed in the name of expediency. I have checked with our investigative team, who have been providing me very timely updates and briefings. They are in the thick of this investigation and are lasered focused on the task ahead. For the members, a critical incident debrief has occurred for the officers who were first on scene at the site of the collision. Supports have been made available for those who are in need for them. I wish I could always give more answers than I can right now, because I know this is very important and needed at this time. However, I know everyone has many questions about what has happened, and I assure you that these answers will come. We respect and appreciate the public's patience. But now comes the tough part for everyone, the methodical, precise investigative steps that are necessary to reach such a conclusion that does take time to do properly. These steps take time. I assure you that our intent, much importantly, is to keep the communication flowing and as transparent as possible. We will continue to communicate what is happening in regards to this investigation, and know you understand we are now entering a phase where those answers will be a bit further apart due to investigational steps. We plan on having a press conference in the coming days to focus on the families. Details of that will be provided as soon as they are available. Thank you for the outpouring of support from across the province and from across Canada for our officers and all of our partners that were involved in this terrible tragedy. Thank you very much.
Thank you, sir. Merci. I'd like to invite Inspector Tim Arsenault of Major Crime Services to the podium to read the statement in French. J'invite Inspecteur Tim Arsenault à prendre la parole.
Bonjour. Merci, Madame le Premier ministre Stefanson, d'être ici avec nous aujourd'hui. Les derniers jours ont été difficiles pour tout le monde au Manitoba. Mais plus que tout, les derniers jours ont été difficiles pour les familles qui ont appris la terrible nouvelle qu'un de leurs êtres chers serait parmi les morts. Nos enquêteurs ont travaillé toute la fin de semaine à chercher des réponses sur ce qui est passé le 15 juin et qui a causé la mort de 15 personnes. Nous avons pu parler à quelques-uns des blessés durant la fin de semaine. C'est une partie très importante de l'enquête, avoir le témoignage de ceux qui étaient là. L'analyse mécanique des deux véhicules est toujours en cours. Ce processus est long et nous n'attendons pas de résultats pour quelques mois encore. Les services de la circulation de la GRC travaillent de près avec le groupe de crimes majeurs depuis le début de l'enquête. Ces enquêteurs spécialisés sont des experts pour trouver les preuves nécessaires pour faire avancer notre enquête. 4 enquêteurs chargés de la reconstruction des collisions, ainsi que 2 enquêteurs de l'équipe de collision criminelle sont sur place avec le groupe de crimes majeurs. Les autopsies sont en cours. Nous commençons par l'identification des victimes, ce qui nous donnera d'autres renseignements pour notre enquête. Tout important, nous prenons toutes les mesures qui s'imposent pour obtenir les réponses de façon la plus efficace possible. Cependant, nous ne sacrifions pas la minutie de notre enquête pour avoir des résultats plus rapidement. J'ai pris des nouvelles de notre équipe d'enquête Elle est bien occupée et ses membres sont concentrés sur le travail qu'ils ont à faire. Un bilan suivant un événement grave a été organisé pour les policiers qui sont intervenus sur les lieux de la collision. De l'aide est toujours à leur disposition s'ils en ont besoin. J'aimerais pouvoir vous donner plus de renseignements. Je sais que vous avez toujours plusieurs questions sur ce qui s'est passé. C'est ici que la partie difficile commence. Les étapes d'enquête précises et méthodiques qui sont nécessaires pour arriver à une collision. Ces étapes prennent du temps. Notre but est de garder des communications régulières et transparentes le plus possible. Nous continuerons de vous tenir au courant des progrès de l'enquête et nous savons que nous entrons maintenant dans une phase où les réponses seront livrées et au goutte-contre-goutte. Nous planifions une conférence de presse centrée sur les familles au cours de les prochains jours. Les détails vous seront transmis dès que possible. Merci pour tout l'appui montré envers nos policiers qui étaient venus des autres provinces et à travers le pays. Merci.
Thank you, sir. Merci. I would like to invite Lanette Siragusa, CEO of Shared Health Manitoba, to the podium. Je voudrais inviter Lanette Siragusa, directrice générale de Shared Health Manitoba, à prendre la parole.
I can provide an update on the patients involved in the devastating collision last Thursday. As of this morning, 10 patients continue to be in hospital. 6 are women, 4 are men, with their ages ranging in their 60s to their 80s. 5 of these patients remain in critical care, while a 6th was moved in the past day to a step-down unit. Our care teams at HSC Winnipeg and Brandon Regional Health Center continue to ensure that the needs of these 10 patients and their families are being met and that they are comfortable. The last few days have been incredibly emotional for all of us. This is the worst tragedy in the history of our entire province, and most especially for the close-knit communities of Carberry and Dauphin. We know that families are grieving and communities are struggling. We know first responders who are at the scene are still trying to process all that has happened. And we know that healthcare providers in Brandon and at Health Sciences Centre continue to diligently care for the injured. It is times like this where we all need to come together as a province and support one another so we can get through this. Mental health professionals in Prairie Mountain Health have set up community support. Previously, it was at the Curling Center in Dauphin, but they have recently advised us that people who are seeking those supports should go to City Hall for direction on where they should go. City Hall is open from 9 a.m. to 4:30 p.m., and you can also contact them by phone at 204-622-3200. The region has also been providing mental health supports in other affected communities, including Carberry, Brandon, and Neepawa. For the first responders and others who were at the scene on Thursday, Prairie Mountain Health and Shared Health has been conducting critical incident stress debriefings and offering support to those who need it. Meanwhile, we have heard heartwarming stories about how affected communities are connecting with each other and supporting their residents. Everyone is helping, and we are very thankful for it. We encourage anyone who is struggling to come to terms with what has happened to reach out and connect with loved ones who they would rely on for emotional support. There are also a number of mental health supports available for those who need it. In Prairie Mountain Health, residents can call a 24/7 crisis line at 1-888-379-7699. Finally, we too want to express our appreciation for everyone who has reached out to those of us in the health system these past few days to check in and express their support and gratitude, both from within Manitoba but also from across the country. We thank everyone for their support, and it means the world to us at times like this. Thank you very much.
Thank you, ma'am. Merci. We will now take questions. We do have a microphone set up just over here for the reporters. Nous allons maintenant répondre aux questions.
Superintendent, can you just tell us if you've been able to speak with the driver of the minibus yet?
Sorry, just to repeat the question, you asked if we were able to speak with the driver of the minibus yet. No, we haven't. Unfortunately, he's still being cared by medical programs, and like I said before, our primary focus on all of our victims is to make sure that their well-being is maintained and they're being cared for with hopes of recovery. We will be speaking to him when the time is right, though.
And do you have any further information on the make, model, passenger size of the minibus?
No, I don't right now.
Do you know if the driver had the appropriate license to be driving that kind of vehicle?
I haven't talked to investigators about that right now. That will surface in the results of the investigation, though, but I don't have that answer right now.
Premier Stefanson, you said you were able to visit the firefighters in Carberry. I'm just wondering if you've had a chance to go to Dauphin or to visit and speak to any of the victims and their families.
Yeah, of course, we want those families, our first and foremost, our thoughts are with those families right now. They are grieving. I want to respect them in their process of grieving. There will be a time for that, and of course our hearts go out. We want to make sure that we're facilitating in every way everything that they need. Again, we'll work with law enforcement, we'll work with shared health just to see how we can help them. Today, we're offering that support to those family members who want to visit their loved ones in hospital to make sure that we're covering off some of those expenses. But again, we know that these families are grieving. We want to respect their privacy at this time.
There's been some talk about the intersection and similar intersections, concerns about safety and things like that. Is that something that the province will look at, those types of intersections, and if any, different measures can be taken to improve safety there?
Yeah, thanks for the question. And of course, we will allow the RCMP to go through the process, and we have to respect that process. I know there's going to be a lot of questions out there that we will endeavor to get the answers to in due course. What I will say is that after any accident or incident on our highways, there is an internal review that takes place. So that review is taking place right now. Because of the extent of the severity of this review, we know we're prepared to go beyond that and bring in experts as needed moving forward to see what that will look like, and we will unfold those and the details of that in due course.
Has that intersection been looked at in the past for possibilities of an overpass or anything else?
So that particular intersection, all intersections across the province are looked at. In terms of the details of that and where that's at, we can get that from the department.
Is there going to be a kind of a centralized place for donations or anyone wanting to support the victims? I know sometimes in tragedies like this, people make fake GoFundMes, for example. Is there any plans for the province to help out with that?
Yeah, so we can certainly, we want to work together with all communities to ensure there has been an outpouring of support, not just across Manitoba, but across the country. So whatever we can do to help coordinate those efforts, we will do that.
Superintendent Lasson, I'm wondering if you might be able to talk about what the most complex part of this investigation is right now for your team.
That's a very good question, and just to reiterate the question was, you asked me about what the most complex part of the investigation is. So above and beyond the difficulty of, like I've said before, is maintaining emotions among our investigators. That's very difficult. But the most complex part of it is, like I said, we have to determine accurate answers. And when I talk about accurate answers, we mean, was someone at fault here? Our job as investigators is to rule that out or to rule that in. And that we get there by gathering evidence. So oftentimes in these types of scenes, it's difficult to gather evidence. It's very difficult because normally we have numerous amount of eyewitnesses. In this case, we don't. All the witnesses were in the bus, and a lot of them are in trauma right now that we can't talk to. So we have to rely on forensic investigations, mechanical analysis of the vehicle, and things like that. And that's why it's taking so long. Normally, we would have more answers because we would have very focused witness accounts very soon after what happened. And this time we don't. This is a very unique situation, and with the numbers involved as well.
You mentioned, Superintendent, you mentioned you've been able to speak to some of the injured. How many people have you been able to speak with?
I can't answer how many people because that'll reveal who we spoke to potentially. But there's been more than one. And, you know, oftentimes as investigators and with experience, people who have undergone critical trauma like this, you know, oftentimes their story, it doesn't come out right away. We have to allow them time. You know, their brain has been impacted, right? So we have to give them time to process.
Premier Stefanson, can you tell us, we know there will be a review on the intersection, but if there's some need to be changed, would you be open to apply some change on that intersection?
Absolutely. I mean, but again, we want the process to unfold. We don't want to rush through this. We want to make sure that we get it right. And so there's still investigations going on right now. We'll respect that process, but, you know, an internal review is always taken. And that is moving forward right now. To the extent, because of the severity, again, I think it's important that we are willing to go beyond that, bring in experts where needed to ensure that, safety of people traveling on our roadways is the most important issue here.
Monsieur Arsenault, peut-être, je ne sais pas si vous pouvez nous expliquer qu'est-ce qui est le plus compliqué en ce moment dans cette enquête-là, le plus complexe.
Oui, certainement. La complexité, le numéro de personnes qui sont morts, qui sont blessés, c'est très compliqué. Puis, un accident comme ça ou une enquête, c'est très important qu'on parle aux personnes qui sont là. Il y en a 15 qui sont morts, les autres sont blessés. Ça prend du temps. Puis il faut attendre que les personnes sont prêtes à nous parler. Autrement, il y a des enquêtes qu'on fait technico pour les automobiles, puis les experts, puis on a du vidéo, il faut l'analyser. Ça prend du temps. Puis les enquêteurs, on a bien parlé de tous nos policiers, puis les autres respondants c'est difficile. C'est un événement qui est pas tous les jours. Puis les émotions que Superintendent Lasson a parlé de, chaque jour, j'en parle avec mes enquêteurs, puis on va faire certains qui ont leur temps aussi dans le processus.
Est-ce qu'on sait combien de personnes ont été rencontrées, puis quels sont le genre de discussions qu'on a avec les gens qui ont été blessés dans cet accident-là?
C'est comme on dit, on n'est pas préparé à mentionner le nombre, c'est plus qu'un. Puis l'information qui nous donne, c'est très important à l'enquête, puis on n'est pas préparé à discloser ça au moment.
Superintendent, we know the medical examiner's office has been working to identify the 15 deceased. Do you know if any have been positively identified as of this time?
Right now, I don't believe we have anyone. Like I said, the autopsies are commencing this morning, and the autopsy is a big part of the identification process. So not at this time, no.
And Lanette, I'm just wondering, given the extent of some of the injuries, if you have any idea if we're talking days, weeks, months that some of these victims might be in the hospital recovering for, if we have any sense of that?
At this point, the team is assessing every day, and we will watch how they're doing. Because of their age, there may be complicating factors as well for some of them, but as we learn more, we'll keep you informed of what the status is.
I have a question for Lanette again. You thanked and mentioned people for reaching out, and I just wonder if you can share some stories or give us an idea of what that looks like. Like, is it other provinces, other health regions?
Yeah, you know what, there was a lot of internal support coming from people in Winnipeg supporting Prairie Mountain and back and forth, the acute people supporting the paramedics, fire and police. We also received communication from many people in written form and sometimes phone calls suggesting just, really understanding how difficult this is, and people reaching out from outside of Manitoba and other healthcare professionals who maybe have been through something similar or are envisioning that how difficult it would be. So it was really, really kind of people to reach out and offer support and someone to talk to if they ever wanted to as well. And so that was great. Thank you.
For Superintendent Lasson, just for Mr. Lasson.
Oh,
Mr.
Lasson, sorry.
You mentioned on Friday during the briefing then that listeners would look at if there was a data recorder on the tractor trailer. Have you determined if there was a data recorder?
That's a very good question, because that's a big part of the investigation that will tell us a lot of information. I don't know if they have it actually right now, but when we do that we're hopeful that's going to tell a lot of story.
Right. And for the analysis of both vehicles, is that done by the RCMP, or do you have experts from other agencies?
Yes, yeah, we have experts, but a lot of it is done by the RCMP. We have experts that look at that, but then we'll contract certain parts out, to do that analysis for sure.
The bus, that was involved, is that, or was that vehicle equipped with seat belts?
I don't know that right now. As you could see on the media coverage, that vehicle was very engulfed and destroyed at the scene. So that's going to be part of this overall analysis to determine exactly what was in that interior of the vehicle, how the seats were situated, etc. For sure. That's it.